that is the least cost per visit or per delivery of healthcare service that we can do, but it's often the best.
As Premier Holt and Nathalie have mentioned, this is exciting news. You know, I do communicate in the legislature with Member Bogus on a regular basis. When are you going to start my clinic? It's today.
If they don't know what their workspace will look like or what their team is going to look like, it's really hard to make a decision because a lot of new physicians are focused on their families, on work-life balance.
Welcome to This Week Uncut, where we take a closer look at the top stories of the week from CHCO-TV and the Courier. I'm Vicki Hogarth.
And I'm Nathalie Sturgeon. We begin this week in St. Stephen, where the province made a pretty significant announcement on healthcare.
This is something that's been a long time coming. St. Stephen was one of the 10 locations promised by the Holt government to have a collaborative care clinic in the first 18 months of their time in office.
I felt like a broken record because every time I got in front of the Premier, I was asking about this clinic, but also asking about St. Andrews. And finally, we have somewhat of an answer from the province on what this clinic is, where it could be located. So we got a little bit more information, but not a lot.
It's always interesting when you get the announcement that there will be an announcement. You don't get the details until you arrive of what it will be. And I know a lot of locals will know there has been the Charlotte County Wellness Collaborative Care Clinic located on the 3rd floor at the Charlotte County Hospital. That's been around since February, but again, due to the limited space in the hospital, it hasn't been able to grow beyond 310 patients are attached to it. I know that you've talked to Dr. Saber, who is leading that clinic, about the challenges that space ultimately leads them to have.
Sure. So Dr. Y.L. Saber is one of the doctors that was recruited, that we'll get into a little bit later, by the Municipal District of St. Stephen to work in the collaborative care clinic. They've only been able to attach 310 patients since February, so a little less than 11 months. And that is because, admittedly, by the Premier's own remarks, because of space. So they can't bring on any more doctors or practitioners, and they can't bring on any more patients because they don't have the room. So this announcement was absent the actual space in which this clinic will actually go. It's currently on the 3rd floor of the Charlotte County Hospital, as you mentioned. But it is planned for another space. It's actually going to be somewhere else, and they couldn't tell us on Tuesday where that space would actually be, although there are rumblings in the community about where it is. I'm not going to say the suspected locations because I don't want to preempt the government, but I also don't want to give the public any false information that may end up not coming to fruition.
And these collaborative care clinics, we should, for anyone who hasn't been following this, though I have a feeling that most New Brunswickers have, there's about 90,000 people across the province who still don't have a primary care provider. In St. Stephen, we've seen doctors retire. We've actually had some pass away this past year as well. So that's left approximately 1,200 people within St. Stephen, and then thousands more in the wards in the rural areas surrounding the town without a primary care provider. So while 310 is great to have attached now to this clinic, it does need to serve a lot more people in Charlotte County. So we went to this announcement not knowing exactly what it would be. We had some ideas, and we were able to sit down with Premier Holt prior to the announcement, do a one-on-one at the Charlotte County Hospital, and that's where we actually found out that they were in the process of signing a lease for a new location.
Yeah, I think I heard in the legislature last week that the number is actually over 100,000 now that are unattached. So as some people are being brought on to collaborative care clinics, some people are being taken off their doctors for retirement, for deaths, for varying reasons. So the list is going up, coming down, going up, coming down. I think this fluctuation is going to happen over time. And there's actually more than 8,000 unattached patients in Southwest New Brunswick. So there are plenty of people outside St. Stephen that are also waiting. In St. Andrews, they're waiting. But we did, get the monetary amount that the government is going to provide for this clinic, and she did tell you about that in this interview.
Here is our interview with Premier Susan Holt at the Charlotte County Hospital before the announcement of the Collaborative Care Clinic in St. Stephen. Your government has promised 10 collaborative health clinics in the first 18 months. That's your mandate. How is the rollout going? We're here for the official opening of the St. Stephen Collaborative Care Clinic, but are you on track to meet that goal?
We are. I think we will have possibly even more than 10 clinics announced this year, and then we anticipate to be able to increase. Our target was 10 for next year and 10 the year after to do 30 in total, but we're seeing such positive uptake and such interest that I think we're going to exceed our target this year and next year and get to 30 a lot sooner than we thought we would.
How many healthcare providers does a clinic like this one here in St. Stephen take on, and how does it work?
Well, every community is different. So that's one of the things that our government was pretty adamant about, is moving away from one size fits all models that were restricting us, right? We saw that. We didn't have a lot of progress on advancing these clinics because they were such a rigid model of who could do it and how and where. Whereas our government has said every community is different. They have different spaces, they have different people, they have different health needs. So we want to build teams of multidisciplinary healthcare professionals, family doctors, nurse practitioners, maybe it's a mental health counselor, maybe it's a physiotherapist, pharmacist, a social worker. The mix will look different in different places. Some places have gone really big. I was just up in Edmundston announcing 14 more healthcare practitioners joining a team, and some places are really small. It's 3 or 4 folks that have come together that want to work in a dedicated team. All of them are sharing records, sharing space, and sharing the patient experience so that that patient gets to the right person at the right time, and that means better care.
There are approximately 310 patients currently attached to this clinic. However, in the St. Stephen area, we've seen a lot of doctors retire. Some have passed away this year. How many more do you expect it to be able to take on, and when?
Well, when we make this announcement of the investment that the government of New Brunswick is making in St. Stephen so that they can have a new dedicated clinic with lots more space, they can add many more healthcare professionals and take thousands of people off the wait list for care. Right now, this clinic is getting really innovative. They're serving unattached patients with a bit of an access clinic, but people want the reassurance of knowing this is my clinic, these are my healthcare professionals, they have my health records, and I can go there anytime and get an appointment when I need one. So we're going to give them that space, we're going to add new healthcare professionals to the team, and we're going to attach those patients.
And when you talk about an access clinic, that means you're not necessarily an ongoing patient of this clinic, but it works similarly to a walk-in clinic. How does that work?
A little bit. I think that's how it's been working here, where sometimes a specialist is available and they can say, you know what, we're going to do a PAP test access clinic. So if you're not attached, you don't have a doctor, but you need a PAP test, you can come in today and we're going to do 15, 20 of those appointments. Or maybe they have a diabetes specialist coming in, and so they can make available appointment slots with somebody that can provide some episodic care. That's not the same as having a doctor that's going to see you consistently time in and time again and get to know you and your family and your health circumstances. So it's better than nothing. It's providing care to people who aren't currently attached, but we're looking forward to making the investment in St. Stephen for that dedicated clinic, the dedicated team where patients can be attached and know that they're going to get care from this group for a long time.
Could we see this clinic become a standalone clinic outside of the hospital in the future if it's able to grow in the future?
That's part of the announcement today, is that this investment is for a new dedicated clinic. We are this close to signing the lease. I had hoped that I'd be able to say exactly where it is. I think a lot of members of the community know where it's going to go, but we don't have the lease locked down yet. But that's part of what this money is going to, is that new space, those renovations. It will be a dedicated clinic outside of the hospital because the hospital needs this space to provide the kind of care that they're providing to acute care patients. And so we're excited to make this, to confirm for the people of St. Stephen that the money is there, the support is there, the lease is going to be signed, the dedicated clinic will be there for them.
Your government is doing a lot of upstream investments this year. how will you measure the success of these clinics, both in terms of the healthcare they're providing, but also in terms of their effect on on finances?
Yeah, great question, because measures are really important to us. We established last January at the state of the province 15 measures that we wanted to be held accountable for. The 2 of them that are related to primary care. One is how many New Brunswickers are attached to a primary care provider and clinic. Because you can hire doctors and give a big number for hundreds of doctors hired, but if that doesn't mean more New Brunswickers getting care, then it's just recycling. So that's the first one that's most important. Have we grown the number of New Brunswickers that are now having a primary care home? And then the next one is, do they have access? Because it's one thing to attach patients to a clinic, it's another whether they can get in 5 days or less. So we measure that. Can you get an appointment when you call? First, within 5 days or less, we're aiming to get that to 48 hours or less, making sure that there are daily appointments available for those needs that can come up that aren't emergency room needs, but can't wait. You know, your sick kid with a fever of 104 is not something you want to wait 5 days to deal with. And so we're measuring those 2 things. And then from a cost perspective, the investments in primary care should take the pressure off ERs. And we should see that expensive form of care that we're delivering shift to the better preventative primary care model and help us stop the growth in acute care costs that we've been seeing for a lot of years.
Maybe explain that a bit to New Brunswickers. When you go to an ER, how much more is the cost than if you were to, say, use the Access Clinic because you don't have a family doctor? Does that have a big impact, and are you seeing this already in communities where it's rolled out sooner?
Yeah, the costs in hospital are significantly more expensive. We see that the costs for someone to be in hospital for a night is more than $1,000. Whereas if you look at somebody in a long-term care facility or nursing home, it's less than half that. And if you move to home care, it's considerably less than that as well. And then if you move to your primary care model, where they're going in to see their nurse practitioner or their team of professionals, that is the least cost per visit or per delivery of healthcare service that we can do, but it's often the best because it's closest to home and it's with those people who know you and know your health profile well and can provide you with the exact right prescription, solution, referral that you need to get the best possible care.
I know Eastern Charlotte will be curious to know too. Blacks Harbour was also on the list of the first 10. When can we expect to see Blacks Harbour roll out?
Yeah, Blacks Harbour is on the list of the second 10 because we had already committed our 10, but we saw the potential, and they actually have some infrastructure that is well suited to this. They have some healthcare professionals coming in and out of that clinic there. So we have an opportunity to really attach healthcare professionals to that clinic, make some of the investments we need to in it. So I expect that one's going to come in the earlier parts of 2026.
And St. Andrews wasn't necessarily on the list yet. Dr. Julie Levesque-Taylor has taken it upon herself to introduce a similar model. How is that working out in the ecosystem of these collaborative care clinics?
Yeah, Dr. Levesque-Taylor has been a real role model for a number of doctors who have been interested in collaborative care, and thankfully she's been willing to share her experience, what she learned doing this elsewhere, and to come and build this kind of collaborative model in St. Andrews. So we've been working really closely with her, really excited to support what her team is doing and continue to invest to expand it so that she can serve more people.
What are your words to New Brunswickers, especially in the Charlotte County area today, when they see this opening of the clinic? How do you expect them to get involved, get themselves on the list?
Well, it's interesting because what we tell people to do is to make sure they're on HealthLink. There's been a lot of talk about the HealthLink numbers. If people aren't on HealthLink, then it's harder for us to attach them. So we actually have been driving people to sign up and make sure they are there on the wait list and that their information is current, that we have the right phone numbers and the right addresses, the right email addresses to reach them. Because as we get this new clinic built and add the new healthcare professionals, we're going to be reaching out to those people on HealthLink to provide them with a new permanent home for their healthcare. So that's my first piece of advice, is make sure you're registered on HealthLink. If you think you are, double check. You never know. The old registry was moved across and things fell through the cracks when that was done a number of years back. So make sure you're on HealthLink, and then I want them to know that our government is committed, and we've put the money forward, we've changed our policies to make this work, we've partnered with the community to get the right location and support the team of people here that started delivering collaborative care when we kind of launched the model in February, and so we are committed to improving the healthcare access for people in this area.
That was our interview with Premier Susan Holt at the Charlotte County Hospital before the Collaborative Care Clinic announcement on Tuesday.
So we did get a chance to speak quickly with Dr. Wael Saber, who is the primary physician for the Collaborative Care Clinic, and it is worth noting that there are 3 nurse practitioners, 2 registered nurses, 2 licensed practical nurses, 1 respiratory therapist, and 1 social worker. So there's 10 in total, but there's only 1 physician. And it was interesting to talk to Dr. Saber about his time here in St. Stephen, which has been short. And he talked about, the space being an issue, about how many people that he knows that are available that want to participate in this clinic but are unable to because of the space. But also he spoke about being begged by patients to be taken on as their primary care provider, because what's unique about St. Stephen is that they've opened an access clinic, which diverts patients from the emergency department with non-life-threatening issues. So prescription renewals, things like that may bring people without a primary care provider to the emergency department, but are not necessarily the emergency department's mandate, right? You go to the emergency department for really life-threatening issues. So this access clinic is providing access to Dr. Saber, but not necessarily on an ongoing basis. So he's talked about patients, really pleading with him to be taken on, but it's not something that he can do by himself. So this new space will be critical, but you will hear in a few moments from journalists who had a lot of questions about this announcement, which was sort of an announcement for the sake of an announcement, because there was no place announced for this clinic to go, and they've clearly identified that the current space is not manageable, is not suitable, and is not where the clinic will be in, say, 4 or 5 months from now. So it was really interesting to have that, and we've talked a little bit about the government's ongoing promises that were made during the election that are not necessarily being kept. She's coming on the 12-month mark of that 18-month mark for 10 clinics. So certainly she may have felt some sort of ongoing political pressure to get these clinics announced for the sake of announcing them. So you will hear questions that are kind of tailored around that, certainly. And it's interesting to note that they've talked about the fact that they want to be part of regions that want to support the collaborative model. St. Andrews is one of them that has done all of the work. They have the space. The council here provides them with free space to do their work and to run their practices, which is very unique. We're going to let you take a listen to the questions from journalists to Dr. Dornan and Premier Susan Holt.
Ms. Bacchus,
You're
the first question of the scrum.
First of all, I want to thank you, because I did bug you constantly about having a clinic here, and you promised one before the end of the year. So have you got an opening date yet, even a tentative one?
Now, we're very close. We're almost signed off on a lease agreement, and so that will determine when the opening date is.
Then there's going to be renovations, obviously,
say,
to get
there
the
has to be
space fit out. But we're looking for those to be rapid renovations, because this is going to open in 2026 and early, hopefully, in 2026. So we'll get the lease signed, we'll get it renovated, and we'll have people in before the snow melts.
Would you say gone are the days of having a family doctor?
No?
I'll get you to come to the mic.
Sir. People may still have a family doctor, but there'll be a family doctor that's part of a team. And gone are the days when everybody has to have a single family doctor and that's all. We are promoting teams. In fact, when Horizon recruits now, they look for people that want to come and be part of a team. So yes, you may have a family doctor. Yes, you may have a nurse practitioner. Some clinics will have family practice nurses that are not quite practitioners. So no, the day is not gone. If you're in a clinic such as the one here, you may be seeing somebody one day, and you may call Dr. Saber your doctor if you had to put a doctor on a file. So no, those days are not gone. I also had to remind people that there are some solo family doctors that will continue to practice in a solo fashion throughout the province, and we support them as well, though we hope they come together as teams.
And secondly, how well is recruitment going? Like, it seems like this model is attractive to new doctors, new nurse practitioners that are just getting out of medicine, going into the workforce. How big of a draw is this program?
It's huge. I have a briefcase not of new doctors. It's of doctors that are practicing here that now want to practice collaboratively. And our government is providing the space for that, support for an electronic medical record, and the backbone of that, overhead costs, for example, nurse practitioners that work in the clinic. So when people come in, that's what they want. The people that are here, that's what the majority want as well.
Nathalie.
The council here has done a lot of work on their own, creating a health committee. They've also allocated, I think 50,000 in this year's budget towards incentives for doctors. I'm just wondering if that type of work on the ground is helping you attract doctors in the gaps that maybe exist from maybe the health authority or the provincial government.
It's absolutely helpful. I mean, we came in with a real mandate and mantra to get out of the office, to work with the partners on the ground, to get out of one-size-fits-all models that tell people how they have to operate. And here we have a really engaged municipal council that took a leadership role and said, we're going to do what it takes to attract healthcare professionals for our community members. And Dr. Dornan and our team and the team at Horizon said, we're going to support you. What do you need? Okay, we need different space. Let's go find it. You want to make an offer of incentives to attract physicians? Great, we can support that because the folks here on the ground know why this is a wonderful place to live, and they can sell it when they get connected to healthcare professionals. They can sell why this is a beautiful place to be. So we've been working in partnership and really appreciate the leadership that the municipality of St. Stephen has shown.
And I'm just wondering, so you said 310 people have been able to come off the list, compared to the 8,000 roughly people in Southwest New Brunswick that are waiting for a primary care provider. That doesn't seem like a lot of patients. Is this a capacity issue because you only have one doctor and two nurse practitioners, or is it a space issue? Like, what is preventing you from taking more patients off the list?
It's a bit of both. So that's why this investment means new space that will have room for more patients and investment in more practitioners so that we can take more patients off the list, because that is the goal, is to get everybody attached as quickly as we can. And we can't do it here. This is not the ideal place. We have other uses for this space. So our government has made the commitment. We had to change policies and pass them through cabinet in order to be able to engage with the right community space that was going to work. But we've now found it. It's bigger, it's better, it's going to mean more healthcare professionals, and more importantly, more people getting attached to a collaborative healthcare team that will serve them and their family.
I'd like to talk about the community. We don't announce a clinic in any community that's not supporting us, supporting the efforts. If we can get people here, but it's the community that keeps people here, engages them, they're become members of clubs, they're sold homes here, they participate in golf courses, and so I can't underestimate the power of the community at partly attracting but mostly retaining people here.
Yes.
When you talk about the investment adding professionals to the clinic, does that mean creating spots, or does that mean people have been actually hired to take in the spots, or does that mean people being transferred in from other units?
It's mostly going to be hiring new people into the new physical space. There may be some people who will want to transfer because they're going to have custom-built, perfect space that's brand new for maybe the most enviable primary care clinic in all of New Brunswick. So I can imagine a lot of people may want to transfer here, but the funds are there to support new healthcare professionals being added to the team so that more residents can come off that wait list.
That was Health Minister Dr. John Dornan and Premier Susan Holt talking about the new collaborative care clinic in St. Stephen.
We are going to take a quick break, but when we come back, we'll be continuing this conversation about the new collaborative care clinic in St. Stephen, along with the work done at the municipal level.
But it's still in the thousands in terms of the rural surrounding areas, and then I think inner St. Stephen is around 1,200, and then there's a few thousand more still on the outside of St. Stephen.
Welcome back to This Week Uncut. I'm Nathalie Sturgeon.
And I'm Vicki Hogarth. We are continuing our conversation about the new collaborative care clinic in St. Stephen, but I know from the perspective of the Municipal Council, you've been following the work of their health committee quite extensively for quite some time now.
Yeah, it's a bit of it's an interesting topic because municipal councils across this province have started to venture into mandates that are not necessarily theirs, and it's not because they want to, it's because they have to. The public is demanding more of its local government. We've seen that on the ground, certainly, and so they've tried to step up in ways that are meaningful to the community. So one of the things that St. Stephen has been doing, they partnered early on. I think we were there for a story with the Southwest Service Commission to get people connected with NB HealthLink, because you need to be on NB HealthLink to be attached to a new collaborative care clinic. But they also established a health committee to start that recruitment and retention process. There was a story, I think last year that I wrote about Horizon getting rid of the incentive program at the Charlotte County Hospital. I never did get specific confirmation on whether that happened or not, but the council stepped up and said, we're going to provide those incentives, those monetary incentives, similar to what they do in other places for scholarships. The New Brunswick Medical Education Foundation actually provides scholarships for years of service. So a municipality can sponsor a doctor's tuition, and in exchange they sign an agreement that says they'll go to that community for 5 years, 4 years, whatever the case may be.
And this isn't something new that we're seeing in Charlotte County. It's something we saw right here in St. Andrews when they opened the Wellness Center in the W.C. O'Neill Arena building that we're in right now, and attracted Dr. Julie Levesque-Taylor to this part of the world. New Brunswick was her home province. She was looking for a reason to come home to practice here, and it was really a municipal effort that got her interested in coming to this town, and she's put roots down and brought her family here. So we've seen it work successfully before. It's very interesting to see St. Stephen doing this at the same time as the collaborative care clinic is coming to life, and now with this new location they can hopefully attract even more.
Well, and it isn't just the monetary side of things. They have set aside $150,000 for this incentive program, and if you go into a story that I wrote about this a while back, you will note that there's different categories and different monetary amounts for different professions, and it's not just exclusive to physicians, it's nurse practitioners as well. So, but Deputy Mayor Ghislaine Wheaton and Councillor Emily Rodas have also taken great personal effort to welcome the Sabre family into St. Stephen. They found them a place to live temporarily till they get themselves settled. They held meetings between the Sabre family and Anglophone South School District. They talked about different clubs that they can join, different programs for their children. And Dr. Sabre's wife is actually a physician who is currently working to get her license in New Brunswick, and hopefully she'll be able to join that collaborative care clinic once there's more space for her to be able to do that. So it's not just the monetary side. They've done tremendous work in the retaining part of the equation, right? Because it's one thing to bring them here and say, we'll give you this amount of money for 2 years. But at the end of the 2 years, if there's nothing meaningful that's happened for their families, for their spouses, for whatever the case may be, they're not going to stay. They're going to go somewhere else to find, a better accommodations, places with more services. So certainly they've undertaken a lot of work to not only recruit Dr. Sabre, but to keep him and to keep his family.
Right, and who knows what makes our area a special place to call home better than the people who live here. So I think that's what's really the neat thing about it, is it does sometimes take that local to say, hey, check out these sports teams, check out these things that we do on the side, check out these nature trails. But we did get a chance to talk to Councillor Emily Rodas after the announcement outside the hospital on our way out, just to hear about what was the work on the municipal level, one that you've been covering as a journalist, again, quite extensively, but what went into getting things ready for this big announcement that we got in November. We know that the footwork on the ground can be extensive and very long.
Take a listen.
But I just know the last 6 months have been crazy busy. We managed to land Dr. Sabre here. We're really excited about that. And we're working with him and his family as well, because his wife is actually a physician too. So she's working on her licensing exams. That was our number one priority, was to start to find some physicians to really lock down a certain roster of patients. But it has just been a whirlwind of sending the province properties and looking at properties and, signing up Dr. Saber's kids for soccer and things like that to get them really invested and tied to the community. So we've kind of been, jackies of all trades, masters of none, but it's been great.
What kind of incentives or ways did you attract the Saber family here? I saw obviously photos on Facebook of you giving tours of St. Stephen, so it really has been quite an extensive effort.
Well, we were connected. He was initially connected with the province, but everything was still up in the air. And then when we first got his contact, we were able to talk to him about what Anglophone South School District looks like here in St. Stephen, what kind of opportunities are here for his children. We talked about everything from sports to education to housing, rentals. We've really gone over everything that would make St. Stephen unique to call home, and that's what kind of secured him, and we managed to find a long-term rental for him. So we are still working on him. We have a municipal incentive that the council developed. It's $125,000 over 5 years, which is huge. One of the most competitive incentives in the province, frankly, maybe in the East Coast. So we're hoping now, this was a huge gap for us. When you have a physician who's working here and you're trying to sign them on for the next 5 years, if they don't know what their workspace will look like or what their team is going to look like, it's really hard to make a decision because a lot of new physicians are focused on their families, on work-life balance. So this announcement today is really a bit of the negotiating card that we haven't had in our back pocket. Now that we have it, I think things will take off from here.
Paint a picture of what the situation is like in St. Stephen. We know that there have been some doctors who've left the community. How many people approximately do you think are still looking for that primary care provider or a clinic of this type to bring them on?
Well, I actually just got some numbers upstairs from Susan Neal, but it's still in the thousands in terms of the rural surrounding areas, and then inner St. Stephen is around 1,200, and then there's a few thousand more still on the outside of St. Stephen. So it's really important with MB HealthLink that everybody gets registered because, like they said in that meeting, we need people to register to be able to take them off the list and get them assigned. So it's still an ongoing stress. I know a lot of people don't have that family physician, so there's nobody to follow their care. If they go to the ER and they have blood work drawn, it's like who's following that blood work, who's reporting back to them. So if we can get that missing gap, that connecting piece for the people that live in our community, it will just be the bridge they need to see the specialists that they need and to actually take care of their whole picture of health, not just individual things every time they go to the ER in crisis.
That was Councillor Emily Rodas at the Charlotte County Hospital discussing the work of the Health Committee of the Municipal District of St. Stephen.
We're going to take a quick break, but when we come back, we're going to take a look at what your tax rates might look like for 2026.
I'm also in favor of holding the tax rate steady and transferring into reserves.
Welcome back to This Week Uncut. I'm Vicki Hogarth.
And I'm Nathalie Sturgeon. So several councils are currently wrapping their bows on their budgets for next year. I wish I had a complete and wholesome picture for our audience, but certainly the municipal councils are making their way to the finish line, but St. Stephen got there first.
Okay, well, I know this is your Super Bowl, so please take the lead. Tell me, what were the highlights? What are you looking at?
Yeah, so tax rates are generally the meat of a budget. So tax rates are set by the municipality. That money gets collected by the province. You will get your property assessment notice in the mail. You will then pay that. Some of that money then gets redistributed to the local government. We have heard a lot about the unfairness and the significant increase in property assessment in recent years. And the government just released a report on how they can improve the property, or some of the feedback that they received on how to improve the property assessment model and formula and how they can work on that. But it is important to note that property assessment is the largest funding source of local governments. It accounts for 83% of their budgeted amount. Other money also comes from unconditional grants, federal grants, things like that. So about 83% is this property assessment money. So the other piece of this puzzle that's really important for people to remember is that there is a property assessment freeze. So if you haven't done any renovations, if you're just living in your house, you shouldn't see any increase in your property assessment, and they've been frozen again for 2026. This does not apply to new builds or renovations. So if you do a renovation to your home, your property assessment is going to go up. You new build, you're going to get a spike. So that's why you would have seen somewhat of an increase across the board in terms of assessment, because communities are developing.
Okay, well, again, my lack of home improvement skills is paying off for me yet again. As you look ahead at 2026 for St. Stephen, tell me what you're seeing.
Yeah, so they're going to hold the tax rates, which I think is, which I'll get into a little bit later, I think is pretty symptomatic of the situation that municipal governments find themselves in. So in St. Stephen, Ward 2 residents will hold at 1.5561 per $100 of assessment. And the other 2 rural wards will hold at 0.5597 per $100 of assessment. The other thing is that the rural wards will also see an additional 41 cents on their tax rate because they pay a fee to the Department of Transportation and Infrastructure for the maintenance of their infrastructure and roads. Those are not part of the municipality. Even though you are part of the municipality, the government did not hand over roads and infrastructure to the municipality, so they still have to pay that 41 cents. So it means that their tax rate is a little bit higher, but they've held the tax rates for this year, and the council was certainly supportive of that decision.
Okay, what was discussion like around the table?
Yeah, so this is a big year for St. Stephen. There's a lot of money that is being borrowed because they need to start investing in infrastructure. And one of the biggest borrowing items is for roads and streets. So about a little more than $5 million will be borrowed to pave roads and streets in the urban ward. As I said, roads in the rural districts are not the responsibility of the municipality, which I will note has led to a lot of frustration even here in St. Andrews. I've heard a lot, Councillor Darrell Weir talking about, calling the Department of Transportation because he's getting complaints from his constituents because they think he can do something about it. But arguably that scope is quite limited. The other thing that was significant to me is the lift station. So a lift station is a part of the water and sewage system, mainly the sewage system, that lifts the sewage up above ground level into an area where it can then be treated. So it's not like bad for the environment, essentially. And so the one that they have is extremely old. It is falling apart. The Deputy Chief Administrative Officer, Sean Morton, said it's being held together with tape and bubble gum. So it is certainly, there is certainly a clock ticking on the lift station. The replacement is about $1.5 million. But not replacing it could mean that untreated sewage, people's poo, may end up leaking out, right? So they don't want that to happen, and they will do everything that they can to ensure that that doesn't happen. But this is the type of infrastructure deficit that the Union of Municipalities of New Brunswick has been talking about for months. There's a $2.5 billion gap in infrastructure for municipalities who have arguably no way to pay for it.
Wow, okay. So St. Stephen first to the finish line, but still so many questions.
Yeah, so I have gone to St. Andrews budget meetings. I believe the intention there is to hold the tax rate. I think we discussed it in a previous episode, some of their priorities, which happen to be parking in the downtown core. And certainly there's some money allocated for the wharf, which was a big discussion this year. But I think the intention is to hold the tax rate there as well. And they'll vote on December 1st on their budgets. I believe the intention in Eastern Charlotte is also to hold the tax rates. And why this is interesting to me is I believe that it is symptomatic of the situation, as I said, that municipalities find themselves in. I think they're too scared to lower it for the sake that the property assessment is frozen and they might get less money. They're afraid to increase it because everybody is complaining about the cost of living and the cost of everything. and it might not actually translate to any new money for them. So I think that they're in a holding pattern, and this property assessment freeze puts them in a bit of a limbo.
Is there any consideration for the fact that we will have municipal elections in May 2026? Is there anything that you're reading into that maybe council thinks, oh, if they're not running again, why do something so drastically different this year when it could be a whole new set of people at the table come May?
Well, there's nothing they can do to the utility budget. Certainly that's a self-sustaining budget. But the capital budget, which I've learned in the last few weeks, is not something that they're required to do. But in May, if there's all new faces around the table, they can start to decide to change these things. Any requests for borrowing, any requests for capital infrastructure must come back to council for approval. So in May, if there's different people at the table, they might say, I'm not interested in paving that street. I'm not interested in borrowing $5.6 million for paving. So it's going to be up to the next council, and that adds a level of uncertainty to the situation as well, because you may end up getting a council in 2026 that may want to raise the tax rates. But it's certainly, there's a lot of moving pieces here, and it's going to be an interesting year for local governments.
All exciting things for 2026.
We're going to take a quick break, but when we come back, we're going to look at what we're doing next week.
I saw the elf behind the shelf on Christmas Day, and smile will be gone away on Christmas Day in the morning.
Welcome back to This Week Uncut. I'm Nathalie Sturgeon.
And I'm Vicki Hogarth. Looking ahead to next week, but before we even get to next week, you might be watching this well after the Santa's Helpers telethon, but that has been I've kind of been on the horizon for so long now. It feels like I'm very much excited to have the telethon, to be a part of this community effort, but it'll be interesting to have that behind us as well. I feel like I've been listening to Christmas music for a really long time now.
It's just like constantly playing in the background. Flo has been editing the children singing, so it's just a consistent Christmas song tune for everybody to listen to for the past week and a half.
Good thing I love Christmas. That's all I can say. I haven't gotten sick of the song Snowflake yet, which is a surprise, but yeah, it gets me in the Christmas spirit. Gets me, unfortunately, shopping early, so that could be problematic. So trying to hold the reins on that one. We've got a lot of things coming up. Parades. I think St. Stephen will be on the Friday, so Patty Anderson, I'm looking at you, my co-host. I hope we're doing that again. I hope the temperature is warm enough, Patty, and I've done it though when it's -10 and still had a good time, though I'm not sure by the end of it people could understand what we were saying. Our mouths were so frozen. But St. Stephen, oh my gosh, I love the St. Stephen Christmas parade because you just see Milltown Boulevard just aligned with people on both sides, faces you know. It goes on forever. It's really like, it's, you know, you think about how big international parade is, but you have that same experience in wintertime, this long parade, and everyone on the street is just really beautiful. So I'm very much looking forward to that and ongoing Christmas activities. So we will be doing some very serious work as well.
Yeah, I think this time of year is a bit of both. A bit of seriousness because it's budget season and there's lots of really consequential decisions that are being made, but also a festive time of year to participate in community endeavors, including Santa's Helpers, the parades, and the open door program with the lighting of the lobster trap Christmas tree here in St. Andrews, which will be happening, I think, after this episode airs. So it's a great time, and I love December. I love January because it's my birthday, but I love Christmas time. It's a wonderful time of year.
I know. That's what why I love being a part of it right here in Charlotte County too. Is that when you're in a small community, people look out for their neighbors. So whether it's Santa's Helpers or turkey drives with the volunteer center that Emily Mura is leading in St. Stephen, and I want to give a shout out to the volunteer center right now. They are looking for, yes, turkey donations, but Nathalie and I went to visit Emily at the volunteer center this week just to hear more about what the needs are. And she said, if there is a way for people to give cash donations, they don't have a lot of space for the turkeys. When you think about how big a turkey is, and there's close to, I think, 500 families that they help in the St. Stephen area alone. It's really extensive, and it speaks to the issues we've been talking about throughout this whole show, right? Various episodes of what we're dealing with, not just here around the world, but we see it. We know our neighbors. We know who needs help. So she is looking for those cash donations to make sure that everyone is able to have a festive meal. Santa's Helpers, we will be helping out the children across Charlotte County to make sure everyone has a Christmas. But we will also be heading up to Fredericton next week for a press gallery visit. And I'm very excited. I know this isn't the main feature of the visit, but we get to be in the press gallery photo this year too, representing Charlotte County. 2 more women on the wall too, which I think is nice for younger generations to see as well, that there's a good number of female reporters taking on politics at the provincial level.
This is my 3rd year as a member of the New Brunswick Press Gallery. This is my first photo, so it's very exciting. We are working really hard right now to get the January edition of the Courier off the ground. December has gone to the print, so you'll be able to pick that up very soon, hopefully. And we worked really hard on getting that done. But we have a shorter timeline to get the January edition done because Vicki and Patrick and myself will be taking a well-deserved vacation in December to spend some downtime both with our families but also with each other and our loved ones. And so we want to get that squared away and dusted and ready so that the volunteers who put in a lot of hard work and time can get that off and handled without us.
But that doesn't mean that we won't have new content over the holidays, because we will be doing a bunch of Christmas specials, some also re-features of the choir performances on Santa's Helpers. So instead of just having that boring fireplace on your television because family's over, why not put on the Children of Charlotte County singing? How special is that? How very local, very small town Christmas. So we will be working on some Christmas specials to brighten your holidays as well.
And there will be news content throughout the Christmas break. I'm hoping to set the website up for as much success as possible, barring the holidays, which are December 25th, 26th, 30th, or 31st and 1st. There will be no content on those days because they're holidays, and we hope that you're not paying attention to the news on those days. But certainly there will be content throughout. We're starting to book our year-end interviews with the mayors, with the premier, so you'll see some of that content as well.
Yeah, it's been a fun way to end the year. I really am. As much as I'm looking forward to time with family and a Christmas vacation, I also look forward to just the end of the year at Charlotte County. It always ends on such a beautiful note, doing a telethon and really celebrating with the community. And I will look forward to celebrating with you at the tree lighting this week too. It'll be exciting.
Very exciting. Sparkle by the Sea is this weekend, so we're excited.
Well, that is our show for today. Thank you for joining us once again on This Week Uncut. I'm Vicki Hogarth.
And I'm Nathalie Sturgeon. See you next week.